just going to start by drawing a basic diagram of the heart. Okay, so we have our superior vena cava, our inferior vena cava. This is our right atrium, left atrium, right ventricle, left ventricle. This is our tricuspid valve. This is our mitral, our pulmonic, and aortic. Now we're just going to talk a little bit about blood flow. So blood flow either goes from the lower part of the body, like draw a little person up here. So if we were to slice our person in half, blood flow from the lower portion of the body goes into the IVC, and from the upper part of the body goes into the superior vena cava, and they go into the right atrium. Just to reiterate, lower parts such as your legs and your stomach, the visceral organs, go into IVC, and upper limbs and head, superior vena cava. Then goes into the right atrium, down through the tricuspid valve into the right ventricle, down through the pulmonic valve. And now we're talking about blood going away from the heart. So now we're looking at the pulmonic artery over here, which we'll label later. Pulmonic, as you can assume, goes to the lungs. After going through the lungs, then we get nice and oxygenated. We use red to demonstrate oxygenation. And now we're talking about blood going to the heart, so we're talking about a vein towards the heart, going through the left atrium, into the through the mitral valve, down into the left ventricle to the aortic valve, and then goes to the body. So just to reiterate some things, we have blood flow that starts going into the heart either from the lower part of the body, going through the inferior vena cava. From the upper part of the body, it's going through the superior vena cava, and it goes into the right atrium, passes through the tricuspid valve, through the right ventricle, through the pulmonic valve, where it's now, this is your pulmonic artery, because remember, blood going away from the heart. Pulmonic artery. Then once it goes up to the lungs, it gets oxygenated in the lungs, starts traveling back to the heart with, as you can surely guess, pulmonic vein. Then goes into our left atrium and through our mitral valve, through our left ventricle to the aortic valve. And then we all know that the aorta is responsible for pumping all that nice oxygenated blood to the rest of the body. You know that a lot of times with our patients who come in with an ischemic stroke, the echo that they do is a transthoracic echo, because it's looking for a PFO, which is a patent foramen ovale, which is an opening between the right and left atrium, which is why we give those echoes with bubbles, because then they would be able to see the bubbles crossing through the atriums. In patients that we know have DVTs or any type of blood clot in their lower extremities, viscerals, all that stuff, we would want them to get an IVC filter in hopes of, if we put a filter here, then hopefully the filter would be able to catch that clot before it travels through here, causing another pulmonary embolism. Not to mention, if your patient if your patient does have a PFO and you have a clot somewhere and it travels into your right atrium and it goes through the PFO, it has a higher chance of going up towards the brain, causing another stroke, or showering other emboli to other locations. Hope this was helpful.